particular bill that they have to offer you health coverage on demand. So essentially, you're in a hospital, you don't have insurance, the carriers actually have to offer it to you. And what I understand is in Massachusetts, which is the first state that really implemented something similar to what we have now, is that finding that people are gaming the system where they would either pay the penalty, in other words, not have insurance, and then buy the insurance if they need it, and then cancel the insurance once they appeal, which is causing healthcare premiums to rise in Massachusetts, in other words, to basically cover this. Is this trend going to happen in the national bill? And what do you think will happen to insurance premiums as a result of it, as more people get in the system?
Well, you're right. Massachusetts is the one state that has this mandate. Now, they've had it for 3 years, give or take. The penalties up on the screen, this is how the bill was written for the federal program. The penalty is $695. There's some adjustment based on your income, and it goes up to a couple thousand for a family. So you do the math there. It's much cheaper to pay the penalty as opposed to insurance. So from the insurance company standpoint, the insurance companies like the fact that there's now 40 million potential new customers. That's good for them. What they don't like, there's a number of things they don't like, and this happens to be one of them because, as John mentioned earlier, there will no longer be pre-existing exclusions when you buy insurance. So essentially, as you described, sir, what's happening in Massachusetts, there's no pre-existing exclusions up there. So individuals, the penalties are less than this, by the way. So residents of Massachusetts, they can go without insurance for 10 years. They need a service, they need a major operation that's $100,000. They buy insurance the month before, have the service, and I think you're required to keep your insurance for 3 months up there. So once you keep it for 3 months, then you can drop it. So what does that do? You know, you're getting a lot of sick people buying insurance, and the healthy people are not in the risk pool, and that is against the whole insurance concept. So as far as amending the provisions as time goes on, as Arnie and John were talking about earlier, this is something personally I hope is changed. I know the insurance companies don't like this penalty. It really needs to be a stronger penalty. And who knows, you know, a lot of things are changing, so maybe this is one of those things that will change. If it doesn't change, though, to answer your question, this can only really have a negative effect on the insurance premiums.
Todd, I would presume, and I don't know this, but that penalty determination was based upon some sort of statistical amount as to what an insurance, premium would cost. Because I don't think they intentionally would have a penalty less than what it would cost to not have the penalty. Now, maybe also that they're using, like they always do, some outdated model, a 10-year-old model as to what costs are. But I would hope that and I agree with you, that certainly a penalty that's less than doing it is not really a penalty at all. And I would hope that they change this. I presume they're getting a lot of pressure to change this at this point in time.
And I don't know how it was developed, but there is something published, Arnie, on, I want to say it's on the healthcare.gov website, and it gives you the average cost of health insurance in every state. So if you wanted to look up New York, the average single premium is close to $6,000 a year. It's published. I mean, this is published by the government. And the family is 20+ thousand. So, when you look at the averages, which are published by the government, and you look at then these penalties, it doesn't really mesh very well.
The last question that came in from the audience segues into this perfectly, I think, with the question of why can't we obtain coverage from an out-of-state carrier? So is that possible?
Well, in the New York area, there's only a handful of carriers that have network accessibility. So really, what you're looking for, if you're looking for healthcare coverage, number one, what networks do your doctors participate in? So what are we going to do? Look for a local HMO in Kansas? It could be very cheap.
Doctor's not there.
But there's no doctors there. I don't know that really makes sense right now. But getting back to this gentleman's question in the back there, you know, basically what you're describing is adverse selection, you know, in insurance. And ultimately, again, in the infinite wisdom of the government, you know, there weren't any really controls put into that. So ideally, you're right. Listen, if I'm sick, I'll think about it myself. If I'm sick, you know, I don't need any insurance. I'll buy it while I'm there, cancel it 3 months later, I'll cancel it. But ultimately, what's going to happen again? As Todd said, the rates, it all passes back. The rates are going to go up. The rates are going to go up. So, you know, something's got to be done, agreed, but, you know, that's the definition of adverse selection, and the rates are just going to go up more. That's what's going to happen.
Do you have any other questions? Courtney?
I don't think this really pertains to anybody in the room, but I'm going to be 25 in February, and I got a letter from my dad's health insurance saying, in the beginning of the year, saying that once I turn 25, I was off this plan, and I could pay like a certain amount of money to stay on this plan. Then a couple of weeks ago, I got a phone call from the insurance carrier saying if I wasn't full-time in school, you know, I had to have proof that I'm full-time in school to stay on this plan. But they said that once January 1st came, I wouldn't have to be full-time on this plan. I can stay on this plan until I'm 30. Then I heard 26, and now I'm scared, because that's a year. So, is it 30? Is it 26? Is it, you know, based on the insurance carrier, or is it a flat age? Because I don't want to think about this for the next 5 years. I'd rather stay till I'm 30. So.
Well, that's a very good question. Did you go to college?
I'm in college right now.
You're in college right now. All right, so there's a couple of things we got to talk about here.
Stay there.
All right.
Well, recommend full-time student until the age of 40.
The first thing, prior to January, if you're going to college, your dad's plan probably has a provision saying that they'll cover college full-time students up to maybe age 25. That's number one. All right, so that's what you have now. Now, also getting to the second point, if you were over age 25, or you decided not to go to school anymore, even forgetting about the health care reform, you did have the option to go into your dad's plan under the New York state law. That's the dependent age to age 30, adult dependence to age 30. But your dad's plan probably renews January 1st, because now you're saying that January 1st, you could be covered up to age 26. That was part of the health care reform. So now, whether you're in college or not, effective January 1st, you can go into your dad's plan. Okay, it doesn't cost you anything. After that, after you're 26, when you're 26, because it's actually up to age 26, then you can still continue coverage, but it would be under the New York state law, which extends it to age 30. Did I answer your question?
That's it.
Okay, good. Yeah.
I have two short questions. What effect, if any, will healthcare reform have on a state-subsidized program like Child Health Plus that many families rely upon for their kids right now? And my second question, unrelated, is will a high savings account, will an employer who offers that be able to administer the money for the deductible straight to an account for the employer?
Well, good questions, but if it's okay, I'm going to answer your second question. All right, I'm going to let somebody answer the first question, because I don't know how it's going to work on the Child Health Plus. I mean, those are the state-subsidized programs. I'm not sure what's going to happen with the state's funding on those particular types of programs. But I can answer your second question about the high-deductible plan. Basically, when you purchase a high-deductible plan, as an employer, there's a couple of options that you have available to you. If you buy a high-deductible plan, you could either pass some, a portion, or all of the deductible onto the employee. All right, but typically what that has to do with is where you're currently at today, your current contribution strategies. In other words, how much is the employer paying for the coverage? How much is the employee paying for the coverage? So those types of factors are usually used in determining whether the employer is going to contribute into an HSA plan or not. Okay, that's number one. Now the employer can establish, with a financial firm, a group accountant, send the money in on a monthly basis, a health savings account. But the one thing that I did want to share with you, which we really didn't go over too much today, is there's also another type of an arrangement. It's called a health reimbursement arrangement. And I like these plans personally myself for employers that have, 7, 8, 25 employees. Or if it's a 1 or 2 person group, maybe they're better off with an HSA. But as the more employees you have, the more applicable this particular strategy is. And the reason I say that is because personally, I'm cheap. I don't like to spend money when I don't have to. And I feel most employers probably feel the same way. So what we can do is under a health reimbursement account, we can go to the employee and say, listen, if you incur claims up to the deductible or up to a specific amount, and we could arbitrarily choose what that amount will be on a contract year basis, we'll reimburse you for those incurred claims. What that does is rather than me as an employer actually taking money and putting it in an actual account for the employee where he might not even be using healthcare services, it minimizes my exposure because I'm only going to pay if the services are used. So in a way, it helps reduce what my employer expense may be. Now, me being the employer, I might not be eligible, and I'd have to speak with my accountant about this. I might not be eligible for a health reimbursement arrangement. I might personally have to set up an HSA, but that's a way that the employer could actually reduce their costs and not have to actually give away the dough that ultimately might not be used.
Can anyone answer the question about the state subsidized program, child health plus?
It's Janice, right?
Yes.
Hi, Janice. I don't have anything more to add from John.
I don't know the program.
I have not heard that it will be changed or what the effect is with all the healthcare reform provisions, and I don't have much more to add on that.
But I'll tell you what, I'm sorry, I will add one thing. What you do need to do if you're an employer, and there was notification given out about a year ago, each employer is supposed to provide their employees with the local, Child Health Plus programs available. And in many times, it might be prudent if we have a family for them to choose a Child Health Plus for their children and elect perhaps a single or an employee and spouse coverage under their group health plan, depending upon what their specific income requirements or income is. So again, it's something to look at. But as far as the funding, it's a popular program. I don't know how the funding works on that with the state.
Thank you for your answers.
I knew there was another question.
On Courtney's point of young adults on parents' policies.
Yes.
There's a difference in cost of premium between a dependent and a young adult that's 25. The young adult that's 25 pays full boat? How does it work?
No, it's a good question. Do you want this one, Todd? I'm sorry. Very good question. What's happening, it's all priced into the insurance carrier. Under the federal law, up to the age 26, it's priced in the contract. So they're not going to be paying a separate premium for my adult child. It's going to be included in. Now, once the child is over, or 26 or over, I'm going to say it depends. It depends upon the contract that the employer purchased.
Courtney's got to check the contract.
She's got to check with her dad, say, when she turns 26, hey dad, is dependent covered, which actually increases the premium, or is there going to be another premium that I'm going to have to pay, or dad's ultimately going to have to pay to cover daughter? Usually, there's going to be a separate premium for that. Because why should we increase the premium in all of our families for the select few that might have an adult dependent between 26 and 30?
I think we have time for maybe, one more question, perhaps? Yeah, a little bit of time, 20 to 10.
We can also, if we wrap up, we can ask our panelists to please stay a few minutes in case anybody thinks of something.
Yeah, if there's no other questions, a couple of little points here. First of all, if you're totally confused and you still want to read about baseball or the Civil War, you'll let me know. Okay, it might be a little easier to grasp. The volume is unbelievable. I think it's really incredible how you... Actually, I feel a little bit better about it than I did going into it, I'm not so sure if that's the consensus of the audience, but I feel like I got a little bit more better knowledge of, it took away some of the mysticism. But again, I think we covered the first 11 pages, and I think there's a lot more to change. And I think it's most important for everybody to realize this is a dynamic process. It's not like the law was passed, and there it is, and it will never be touched again for another 4 years. That's not it at all. And I think, as you pointed out, with the Republican House, it could very well start having all sorts of changes in the next 2 years, and then who knows what the next presidential election would bring, because it goes all the way to 2018. So we might be seeing more significant changes with this whole healthcare reform bill over the next 4 to 6 years. I mean, this is huge. I would like to thank John and Arnold and Todd for a terrific presentation. I wish I could have shared my own expertise, but I couldn't. So that's why we brought you in here.